Hello, I'm Akila Jackson. I'm going to be performing a sterile tracheostomy suctioning. So the first thing I'll do is check the patient's chart, make sure there's an order in there, and so I can know the reason why. I have to have an order. I have to know the reason why I'm doing the suctioning. So before I enter the room, I'm going to perform hand hygiene. I'll have a mask and a shield on just to protect myself from any secretions that may be expelled from the suctioning. So, all right. Let's get started. Hi, my name is Akila. I'll be your student nurse today. Can you please tell me your name and your date of birth as I check your ID bed? Okay, great. So I'm going to be doing a suctioning of your tracheostomy. Have you been having some difficulty breathing? Slight difficulty? Okay, all right. So I'm going to keep the monitor on so I can check your oxygen level continuously, and I'm going to check the suctioning. Make sure the suctioning is working. Okay, I'm turning on continuous suctioning. Suctioning, I'm going to put it at 110 millimeters mercury. I cannot go over 150 millimeters mercury, of course. So, all right, I have your suctioning tube and your yanker available right here. So I will go ahead and listen to your lung sounds first. All right. Okay. I heard your lung sounds. You do have, I can tell why you are having some difficulty breathing. So let's go ahead and perform this sectioning so that way you can breathe better, okay? Clear out your airway. So the first thing I would like to do is place the chucks over your chest. This is water resistant. I do not want you to get wet while we're doing this procedure. Okay, so I have my normal saline. Open it up and lift it, the label away from me, or towards me. Okay, I have that, set that to the side. I'm going to open up my packet, my tracheostomy packet. Only opening the outside, making sure not to touch the inside because that is sterile. All right, and now I'm going to, there's the package. I'm going to go ahead and, I'm not going to reach over it, of course. I'm going to open up my sterile gloves. And place my right hand in first, my dominant hand. Go ahead and grab my left glove. All right, get rid of that. That's not needed anymore. All right, so now I can go ahead and touch inside of my tracheostomy packet. There's some gloves in here that I can sit to the side. I'm going to grab the box first, making sure not to touch the inside of the box. All right, and then okay, now I can sit this down. It doesn't have to be sterile. The outside of it doesn't have to be sterile. So as long as I don't touch the inside. Okay, so now I'm going to grab my trach suctioning. Get rid of this. All right, so with my right hand, I'm gonna wrap it around my hand, and all right, for the Y port down here, I'm going to go ahead and this is what my left hand will touch. So I'm gonna make sure my right hand does not touch it once my left hand gets contaminated, which it will right now, because I'm going to go ahead and I took my yanker off, and I'm going to connect my tubing, my suction tubing with my trach tubing, trach suction tubing. Okay, so now my left hand is considered contaminated. All right, so with my left hand, I'm going to pour my normal saline into the box. Okay, now I can go ahead and have my patient hyperventilate. So Mr. Jones, I'm going to have you hyperventilate for me. So I'm going to take some deep breaths in and out for 30 seconds, okay? No more than 6 breaths. All right, you're doing great. All right, 30 seconds are up. I'm going to remove this. All right, suction tubing, like I said, is connected. So I'm going to place this inside of the normal saline, my suction tubing or trach tubing in the saline. And I'm going to cover up the Y port with my thumb so it's suctioned through. Okay, suction is working. All right, Mr. Jones, I'm going to go into your trach now, making sure not to touch any part of the opening. I will not want to get this contaminated. Okay, so it's in there at 9 centimeters. I'm going to go a little bit further, 2 more centimeters. Okay, now I'm going to cover up the wide port and release, cover, release, and I'm rotating the tubing as I pull out. Okay, so I made sure I was not suctioning for more than 10 to 15, well, no more than 15 seconds. I'm only suctioning for 10 to 15 seconds at a time. All right, so I'm going to wrap this around my hand now, making sure not to touch the port, the wide port. Now I'm going to place mask over my patient again. We have you hyperventilate again, Mr. Jones. No more than 30 seconds. How are you doing? Doing okay? Let me know if you need me to stop at all, okay? All right, so your oxygen level is increasing. You're at 89%. Now you're up to 91, so I'm going to suction you again, okay? All right, great. So let's go ahead and cover the wide port with my thumb. And, well, I put the water, put this in first, in the normal saline first, then cover up the wide port. Okay, suction through. Let's go in again, 9 centimeters. All right, and then another 2. All right, I'm going to rotate as I release. Suction, cover. All right, perfect. All right, how are you feeling? Doing okay? All right, looks like your oxygen level is increasing again. It's went up some more. We're at 93%. Let's just do one more, okay? All right, so I'm going to dip this in the saline again, cover up the wide port. Suction works. Tube is lubricated, so I'm going in again without touching the trach. All right, at 9 centimeters. Now 2 more centimeters in. All right, I'm going to rotate out as I release. Cover, release, cover. All right, perfect. Okay, we're all done. Okay, I'm going to go ahead and cover you up. Put your mask back on you. All right, everything's non. Actually, I'm going to, before I disconnect, I'm going to suction out your mouth. All right, perfect. All right, great. Now, let's go ahead and put your oxygen mask back on. Okay. All right. Now I'm going to connect the yanker back together, and I'm going to lower your oxygen. Okay. Let me go ahead and reassess your lungs again. All right, your lungs sound good. How are you feeling? Are you having any pain? Okay, and your oxygen level is at 96% now after your suctioning, okay? So I'm going to let the doctor know that you tolerated the procedure well. I'm going to document you tolerated it well, you had no pain, and that I'm going to go ahead and keep you at a semi-Fowler's. You know, your head can't be lower than 30 degrees. So are you okay with that? All right, do you need anything at the moment? Okay, so no pain, do you need to use the restroom? All right, here's your call light and your personal belongings. All right, just give us a call if you need anything. Thank you. I'll go ahead and take my gloves off, perform hand hygiene, and document the suctioning.